stand up, please. Thank you. Everybody who can stand should, but everybody else, right? Don't have to. All right, thank you very much. This is great. I think we've timed this just so that the sirens will go off, the civil defense sirens. It's a two-pronged thing to prove that they're actually working or something. I don't know. Will that mess you guys up, do you think? I don't know if we'll hear them in here or not, but I think they're supposed to go off in like 2 minutes or something like that. Come on, Beth. Where's Gordon? Gordon, you too. You can't hide. You have to come up. Gordon. Gordon said to me today, do I get to speak? Can I go first? I really want to talk. Right? You know, I'm really upset that I don't get to talk more often and take over and all of that. Well, everybody's here, right? If you'll notice, I want the media to take note. Everybody's still speaking with one another. They're not. The body language is all very positive here today. The reason I say that is that this, of course, is the benchmark health benefit package culmination of discussions and interaction between a very great and wide and deep variety of groups, organizations, and individuals that have an interest, including consumer groups, providers, healthcare providers, insurers, hospitals, professions, all gathered together, including some commentary along the way about should the insurers be part of the group and so on. And I think that what we've accomplished and what we'll be announcing today shows that this was not a contest. This was not an opportunity to see who we could pit against each other, but rather an opportunity to see how could we blend each special interest that was out there into a public interest that accommodated the whole community. That's what we wanted to accomplish, and that's what was done. We have an announcement today that we've made a major milestone in ensuring that the people of Hawaii have access to high-quality health care, as indicated by the Affordable Care Act, which will come into full bloom in 2014. We're very, very fortunate. I see Roz here today. Are there any other legislators, Roz, here today? But Roz can speak or represent the legislators then that we've worked with to help bring the Hawaii side of this together. Beth Geesting is with me, the Healthcare Transformation Coordinator, and Gordon Ito, from the Department of Commerce and Consumer Affairs consultant, but even more importantly from the Insurance Division. If we're talking about insurance, Gordon is the go-to person who can enunciate exactly what it is we're going to do. Now, essentially what we've done is to put into effect the Ten Commandments, the Ten Commandments of healthcare that we have, and with a healthcare vision here in the state. This has not been as difficult as it is for other states or has been for other states because of the pioneer work that was done in the state of Hawaii way back in the 1970s with the Prepaid Health Care Act. That visionary piece of legislation in those days has stood the test of time very, very well. In fact, what we discovered was, in order to meet the Ten Commandments that I call them, the essential health benefits is what the federal government calls them at this time. Everything from ambulatory patient service, emergency services, prescription drugs, pediatric services, including oral and vision care, almost everything in the essential health benefits, the basic plan for the entire nation, we cover pretty much in Hawaii. And so what we've done is what we needed to do was pick a plan that existed now, and that's the HMSA Preferred Provider Plan 2010. But this was not a contest between plans. This was simply to try and take an existing plan that essentially covered all the benefits and put that forward with the knowledge that as a result of the collaborative effort that we've had to this point, all of the plans in Hawaii meet this very, very easily. There may be one or two plans that have to dot an I or cross a T in some particular element of the essential benefits package. But the HMSA Preferred Provider Plan 2010 is simply the lead dog on this benefits package sled, and everybody will be all of the plans will have this basic health benefit proposition with very, very little change, if any, to be made in almost all the plans. The principal effect of this is to put us in the forefront of the nation in terms of our preparation for 2014, when we move to take care of the rest of those in our state who are not insured. The overwhelming majority of our people are insured. The overwhelming majority will see very little in the way of changes because of the comprehensive nature of our insurance policies to begin with. But for those 80+ thousand people in Hawaii, adults and kids who are currently uninsured, we are now moving, as a result of this foundation that we've set with the Hawaii benefits package, to see to it that they have coverage by 2014. It'll be through the Medicaid expansion, and for those who are not eligible there, tax credits for premiums to make the health care packages more affordable. They'll be able to go to the insurance exchange that we're setting up, where they can choose a plan that best suits them, their needs, and their pocketbooks. And we will be coordinating with them on tax credits in order to see to it that everyone is able to have insurance. So this is the first major step. Hawaii, I'm very, very proud of everybody associated with it. We're not just moving forward, but I think we're moving into the forefront of seeing to it that we provide the broadest possible, most far-reaching health care insurance plan in the nation. And the people who have been, the person most to be credited for putting all this together is Beth Giesting, our health care coordinator. And on the insurance side of things, making sure that all of the I's are dotted and the T's crossed is Gordon Ito. So I'm going to turn it over to Beth now, and with my thanks and the thanks of everybody in Hawaii for the absolutely first-rate job that you've been doing.
Thank you, Governor. I just wanted to clarify what this announcement today means for most people in Hawaii. And in fact, for most people, they won't even notice it. And that really is a good thing, because through our Prepaid Healthcare Act, we have had such high quality and consistent coverage for most people who have employer-sponsored health care that they will not really see much of a difference at all. But the important thing about today's announcement is that it sets the standard for years to come, so that everybody in the state, no matter how they get their coverage inside the insurance exchange or outside in the individual market or in the business market, will have the same high standards of coverage. It is a very important step in our progress toward our goals of ensuring universal coverage in the state of Hawaii and a high standard of health care. So it has been my privilege to be working on this, and I think the governor gave me far too much credit. This is really a result of a lot of hard work on the part of Gordon Ito, who is here with us, and I'm going to let him help us out with question and answers here in just a minute. But I also wanted to let you know that we will be posting a spreadsheet that shows what the specific benefits are that are going to be covered. So if people wonder what really does this mean and what's the level of coverage that we can expect, that will be made available. And the website for that is www.hawaii.gov hawaii.gov/DCCA/INS for insurance. So again, hawaii.gov/DCCA/INS, and it will be listed under hot topics. And I think we're also going to be sending out a release that will have that information. So thank you, and we are open for questions.
Mr. Ito will now give brief remarks. You can tell them about the insurance side, what to expect, Gordon.
Under the Patient Protection and Affordable Care Act, which is the federal law, the state was required to select a benchmark package of benefits. We, the insurance division, hired an actuary and did a plan comparison between the various plans that the federal government had identified as the list that we could choose from. The comparison indicated that the benefits between the various plans were very similar. Some of the criteria that we had used in selecting was based on the benefit package that offered the most benefits, the affordability. We also considered what plan would create the least market disruption. Based on our various criteria, we had recommended the HMSA 2010 plan to the government for selection.
Any questions? Yes, Gina. Yes, the differences were slight to almost non-existent. There may be, like on the vision or some of the pediatric stuff, there may be some, with some it's a rider, with some it wasn't, or something like that. And the costs were compatible or comparable. Oh, no. This is more for it's an interesting thing to be able to make an announcement that you've been doing things the right way for so long that what you're required to do now to meet the standards is in effect very little. It's less the question of standards or even the comparison between the plans, which we very rapidly concluded was not much of an activity, but rather that how do we then move this toward providing for the 80,000 plus people that don't have insurance now. That's where the costs come in. For your employer or your individual buying a health care premium, when someone is uninsured and then finds themselves in the emergency room or finds themselves with an extended illness or finds themselves, as the news indicated last week, a homeless person with severe difficulties and challenges mentally and so on, calling emergency services 140 times or whatever the number was in a year. Those things cost, and that is then reflected in your health care premium. And that is cost shifted then to everybody. So what this is going to do is actually, I think, in the end, bring health care costs much more into line so that the spending is much more rational.
Is the effectiveness to give HMSA sort of inside track on
No.
competing for those 80,000?
No, not at all. That's why I've been at great pains, and Gordon was at great pains to indicate this was never a contest among plans. It never was. But in the end, you have to, in order to satisfy the terms and conditions of the Affordable Care Act, you have to pick something. So what we did was pick the HMSA 2010 plan as having met virtually everything here that we concluded should be a standard, and that it was almost the equivalent of every other plan as well. So everybody was talking to everybody and agreed that if we set that plan and set it in terms of meeting the essential health benefits required by the Affordable Care Act, that everybody else would meet the same standards. So you won't find any differences when you actually get to the exchange. I don't think you will. There may be some riders, some things that you can get for addition. that all the health plans have now. If you want to get some extra benefit or something, and you may want to do that. But that's all it'll be. It will be all the plans will have the same basic approach now, but there may be extras that you may want to purchase or take a look at. That's all. Oh yeah, everybody can do this. Everybody's going to measure themselves against it. You won't have to think about it anymore. That's really what it comes down to, is that the consumer then will have confidence that when they look over these essential health benefits, that every plan, no matter which one they take, will have these as the baseline. My point, I guess, was whether, regardless of what plan we have in the state now, virtually every one of them met virtually every condition as it was. I could have almost thrown a dart at the board.
How much would this cost the individual? Do we have a plan or a figure here?
Well, I'm not sure what you mean.
Are the 80,000 uninsured, is this plan for them?
Oh, yes. That's what that remains to be seen, because it will take place finally for everybody in 2014. And we're thinking that because uninsured individuals now have such a high cost with respect to like emergency rooms and so on, that once we kick in the insurance like Medicaid, so those who are Medicaid will become Medicaid eligible, that I'm fairly confident that the costs will start to go down, and that'll be reflected in the price. So I can't say with any definitive nature what the individual premium will cost with regard to the 80,000 people, other than we know that without any insurance, the costs are astronomical. Nothing happens to the prepaid health care law. It continues in full force and effect. When we put together the Affordable Care Act, Hawaii had a provision in the act which made certain that all the benefits that we already have from our extensive experience going back into the 1970s continue. And I want to mention, by the way, the legislature also, when it did its work, Roz could speak to it, made sure that we were in tune with everything we were doing with the Affordable Care Act here in Hawaii is in conjunction with and in tune with the Affordable Care Act. That's correct, right, Roz? Yeah.
Is there a definition of quote-unquote affordable? Does it have to be a certain percentage of income?
Yeah, Beth, you can speak to or Gordon can. Yeah, that exists. Well, I don't want to get into it. I can, but I don't want to.
As far as
you can talk about the tax credits and so on. I mean, what's
right.
proposed?
Yes, I mean, there's many provisions in ACA which will be implemented in 2014. With respect to the term affordable, I mean, there's no per se definition of affordable. It varies from plan to plan, state to state, and based on an individual's income. But there are many provisions with respect to ACA that will go into effect, which will have impact on premium. The selection of this benchmark package sets the minimum floor of benefits that are going to be offered in every plan. Other provisions that come into play in 2014 include new rating rules that health plans have to comply with. There's also provisions within ACA creating a reinsurance program. There's a provision with respect to what the term risk corridors, so there's adjustment of risk between plans. And so come 2014, it will be really a new day to use the governor's plan. And we'll see how the healthcare premiums will be impacted.
I think the fact that HMSA contributed $200,000 to the health project had no influence at all on this decision.
I don't see how it could. There's no, yeah, look, I want to make absolutely sure you understand. There's no contest here between the plans. Our plans are so comprehensive that I meant it when I said I almost could have thrown a dart at a board with the various plans on, and all would have been okay. They've got the money. So does Kaiser and others that are doing so well. Are doing so well because they provide the service. That helped us to enable everybody to be able to get together and do all this work. It had nothing to do with me. They didn't give me $200,000. I can tell you that. I have to struggle all the time for getting funding. We've gotten funding from grants and foundations for everything from IT, information technology, to helping us with schools, and the insurers understand that their best interests are directly affected in a positive way by us coming to a rational basis for the provision of health care nationwide, not just in the state. My criteria is very, very simple with regard to accepting funding from special interests. If your special interest and the public interest coincide, then I'm going to be an advocate for it, and we're going to take full advantage of that. If your special interest becomes a private interest at the expense of the public interest, then it's going to be opposed. In this instance, I wanted everybody inside and not competing with one another. Everybody having to make their contribution in communication with each other freely and formally, because I wanted to make sure that all the special interests involved here, whether it's hospitals, whether it's the medical professions and its various aspects, whether it's insurers, whether it's consumer groups, I wanted to make sure everybody's special interest coincided with the public interest. I am the guardian, if you will, of the public interest in this because the law requires me to make the choice. And so I feel very, very confident that I can say to the public at large, this is an ideal instance of private, nonprofit, and public institutions, groups, and individuals working together to take their combined special interests and end up with a product and a proposal that clearly meets every possible standard with regard to the public interest being served.
What effect does it have on the vendors marketplace then? So when can people start buying from the connector?
Oh,
and by that time, will it only be the HMSA plan, or can HMAA, UHA, or a new vendor?
There can be 100 of them.
Okay.
Yeah, you'll get to choose. That's the good part about this. We don't choose anything in the insurance exchange. The consumer is completely in control of that, and everybody who wants to make a proposal in terms of an insurance offering will have to compete for that. No one gets any favoritism in this. This is why this is all in the public interest. What we're moving to, instead of just getting one or two, for example, which is the way it worked in Hawaii. Everybody competed. Some people competed better than others, and we ended up with a couple of providers being the major big dogs. But in the exchange, you will be able to take whatever you think is best suits you. Is that a fair summary?
It certainly is. I would just emphasize that this was the selection of an array of benefits. The best array of benefits happened to be the plan that was offered by HMSA, but henceforth, all of the health plans will have the same array of benefits unless they choose to enhance them with additional ones. But it is selecting this plan to be the benchmark or the floor for benefits. As far as your timeline question is concerned, by October 1st, 2013, 1 year from today, our insurance connector our Hawaii Health Connector, the insurance exchange, will be open for business and people will be able to start shopping there. Their coverage will start on January 1st, 2014.
For example, some people prefer to go to a whole array of doctors and have a choice. Other people prefer to go to an HMO that provides everything in one spot. So, I mean, the point is, are all the benefits going to be available to you? The answer is yes. Who you choose to make the provider of those benefits to you will be entirely up to the individual.
And what happens for business rates, or Ms. Rita, do you know this? Like currently one small business can be paying X per month, and another big business might be paying a whole lot less. Is there any benefit to the employer that comes from the connector, besides getting the uninsured individuals on?
One of the benefits for small employer groups that can purchase through the connector is that they would be eligible to get tax credits if they purchase through the connector. And so that's one of the really big benefits small employer groups will happen to enjoy.
And if they don't go through the connector,
Then they won't be eligible to qualify for the tax credits. Similarly, on the individual side, there's going to be tax subsidies that are going to be eligible for individuals who purchase through the connector. And depending on your income level in relationship to the poverty level, the subsidies will vary.
Just on that, the idea is to get everybody insured and to make it as easy as possible for everybody to be able to understand what it is they're getting for insurance and to give them as broad a choice as they can within their means. The whole idea is to get as universal coverage of insurance, by insurance, as possible, because that is the clear way forward to lowering costs. If we lower costs, then we can lower the spending that chases it. Right now, it is not the spending on medical needs that is the difficulty. It's the runaway costs associated with it. And as our population grows older, and as the population growing older lives longer, this is particularly important that we get costs under control. And if we can do that, then we believe one of the principal ways to do that, to accomplish that, is to get universal insurance. The more we have insurance, the less likely it is, the broader the base of insurance, the less likely it is that people show up at emergency rooms with no insurance, and that the rest of us end up having to share the cost burden that's involved in that. Insurance for everybody is the most efficient way to bring costs in line with regard to health care. Thank you very much. Thanks, Gordon.